Hey everyone, and welcome. Today we are diving into one of the most incredible but honestly often overlooked parts of pregnancy, the postnatal period. We're going to call it the fourth trimester, and I'm going to give you a clear week-by-week guide to help you navigate this really critical time.
So, after all that anticipation, the baby has finally arrived, and it's just this incredible world-shifting moment. But as everyone's attention turns to the newborn, there's a huge question that comes up for the new mom. What happens now? Because for you, a whole new journey is literally just beginning.
You know, there's a clinical term for this period. It's called the Puerperium, and it's basically this 6-week or 42-day window right after you give birth. This is when your body goes through this amazing process of getting back to its pre-pregnant state, and that's not just physical, it's psychological too. So here's what we're going to cover. First, we'll talk about what this fourth trimester really is. Then, we'll walk through the first 24 hours, the first week, and the whole 6-week journey. And this is super important. We are going to cover the warning signs to watch for, and we'll wrap it all up with a really practical postnatal care plan.
Okay, first things first, let's get a handle on the timeline. Honestly, just understanding the different phases is the first step to feeling way more prepared for all the changes that are coming your way.
We can actually break this postnatal journey down into 3 distinct phases. First, you've got the immediate phase, which is that super critical first 24 hours. Then you move into the early phase, which covers the rest of that first week. And finally, there's the late phase, which takes you all the way to that 6-week mark. Each one has its own unique focus and its own milestones. All right, let's zoom in on the most intense period, those first 24 hours. The main goal here is all about safety. Your healthcare providers are going to be monitoring you really closely to make sure there are no immediate complications right after delivery.
So, what does that monitoring actually look like? Well, it's basically a checklist of key things. They're checking your vital signs, your blood pressure, pulse, temperature, all pretty regularly. They'll keep an eye on bleeding and make sure your uterus is contracting the way it should to prevent hemorrhage. This is also that golden hour to encourage the first breastfeed, which is fantastic for both you and the baby.
Okay, once you're past that intense first day, you enter the early phase. And this first week, wow, it is a time of incredible, rapid change. Seriously, think of it like your body's amazing recalibration after the absolute marathon of childbirth.
One of the most mind-blowing changes is something called uterine involution. Right after you give birth, your uterus is about the size of a grapefruit and you can feel it right around your belly button. But then it starts shrinking by about 1 to 2 centimeters every single day. By the end of 6 weeks, it's back to its original size. It's just an amazing process.
Another really key sign that you're healing well is the postpartum vaginal discharge, which is called lochia, and it's supposed to change color over time. That's a good thing. It starts out as red, called lochia rubra, for a few days. Then it transitions to a pinkish-brown serosa, and finally it becomes a yellowish-white alba. Seeing this progression is a totally normal and healthy sign that your uterus is healing on the inside.
And then, right around day 3 or 4, another huge thing happens. Your mature breast milk usually comes in. For the first few days, your breasts produce this incredible stuff called colostrum. It's a thick, golden fluid that is just packed with antibodies. Then, that transitions to the breast milk that's going to nourish your baby for the months ahead.
Now let's zoom out and look at the whole 6-week transformation, because as your body is finishing up its physical healing, it is just as important to focus on your emotional and psychological health during this massive life adjustment.
Okay, this is a really important one. We have to understand the difference between the baby blues and postpartum depression. The baby blues are super common. We're talking mild mood swings, feeling a bit weepy, and it usually goes away on its own within a couple of weeks. But postpartum depression is more severe, it's a persistent sadness that doesn't lift, and it is a serious condition that absolutely requires professional medical care. Please do not hesitate to reach out for help if you think you might be struggling. And that brings us to a really critical, really empowering section. Knowing the maternal danger signs isn't about scaring you. Not at all. It's about giving you the knowledge you need to be your own advocate and to seek care when you need it most.
You know, the whole goal of good postnatal care is captured perfectly in this quote. It's all about catching any potential problems early. And being an active participant in monitoring your own health is absolutely key to making that happen.
I want you to take a really good look at this list. These are the red flags. heavy bleeding, a fever over 38 degrees Celsius, foul-smelling discharge, severe pain, or thoughts of harm. These are not normal parts of recovery. If you experience any of these, it is so important to seek immediate medical attention.
All right, let's finish this up on a really proactive note with your postnatal care plan. I want you to think of this as your practical toolkit for supporting your health and well-being through this whole fourth trimester. So, your postnatal health really rests on 5 key pillars. It's not just one thing. It's a combination of good nutrition, a high-protein diet is fantastic, getting as much rest as you possibly can, proper hygiene, some gentle exercise like Kegels once you get the okay, and of course, a strong support system. During your care, these are the kinds of topics you should be learning about. This is the information that empowers you. Things like breastfeeding tips, perineal care, nutrition, and even family planning options for the future. This is what helps you take care of yourself and your new baby with real confidence.
And hey, you're not on your own in this. The World Health Organization recommends a really clear schedule for postnatal visits. There should be a check-in within 24 hours, another one around day 3, one more between weeks 1 and 2, and then a final comprehensive checkup at 6 weeks.
Look, the fourth trimester is intense. It's challenging, and it's also incredibly beautiful. By understanding the phases, listening to your body, knowing those warning signs, and having a solid plan, you can navigate it not just with resilience, but with true confidence. We really hope this guide helps you do just that.